Good evening, I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Southside Hospital in Bayshore to help you sort through what's going on with COVID-19 in our communities and all across the region. And we want to hear from you. This is a call-in show, so call us at the number right there at the bottom of your screen, 516-393-1800. Well, today, Governor Cuomo laid out a very measured 12-point plan for what he's calling unpausing the state. He says it's a fact-based, data-driven reopening plan that would keep people safe and allow the economy to reopen in phases. Now, he cautioned against being too hasty and said New Yorkers need to respect what we've accomplished so far. The governor said overall the numbers are coming down and reducing, but not at a tremendous rate. I mean, the numbers are still staggering. Statewide, positive cases are nearing 300,000. That's just statewide, 300,000. Both Nassau and Suffolk executives say hospitalization rates are on a steady decline. Both are hoping to meet that CDC guideline. That's a 14-day decline so that they can begin the reopening process. That would be phase one. The total coronavirus cases island-wide now more than 68,000. Look at that. Now, the death toll in the state continues to climb now at a staggering number. I mean, that's the death toll. Just let that sink in for a second. 17,600 since the end of February have died in our state. Long Island hit hard. More than 2,700 lives just on Long Island. All right, joining us now tonight is Dr. Garra, Associate Chair of Emergency Medicine at Southside Hospital in Bayshore. He'll be joining us remotely. Doctor, I want to thank you too. You're one of the on the front lines every day. Thank you so much for everything you do every day and for taking the time after an incredibly long day and speaking with us. So I thank you very much. Let me start off by asking, how are you and your colleagues holding up?
Pretty good. The spirits are high. We're seeing a reduction in the number of cases that are coming in on a daily basis, which is nice. And we're keeping our fingers crossed that we're going to continue in that pattern. I
know Southside, I mean, your hospital's hit very hard. I mean, you even had the cross-country nurses come in to help out from all over the country. Are you still seeing, are those numbers coming down? Are you still at 100% or are you down below that?
No, definitely. Volume has gone down and the number of cases in hospital have gone down, both those who have been diagnosed with COVID as well as those who are requiring intensive care and ventilators. So all very positive directions.
Okay. And let me ask you this. You hear both county executives and the governor saying that we're going to start thinking about reopening the economy. You're on the front lines. You're in the hospitals. You see patients on a daily basis. Is it time for us to start relaxing our economy and our lockdown?
Well, I think we need to maintain social distancing. We need to maintain caution. And everything that's put in place so far has been a step in the right direction. I think it would be great for the economy to open up, but of course we have to be very cautious about that so that we don't fuel the fire of this pandemic.
Okay, let's get to some of the callers right now. I think we'll start with Donna from Farmingville. Donna, you there?
Yes, I'm here.
Thanks for calling, and what's your question?
My question is, I've been very safe, staying home, not going anywhere. And I have a question. My daughter's boyfriend comes over once in a while. He works in a nursing home in Stony Brook. And he's exposed to it, and I want to know if he should still come over and how long does it take for him to not come here anymore.
Yeah, that's a tough question. I mean, you know, obviously it's one of those situations where he is got a potential exposure to the virus. And so, you know, the idea behind social distancing and maintaining self-quarantine and self-isolation, I think, is probably the wisest of maneuvers. I understand that it's extremely hard to do that. I think certainly all of us feel that right now. But, you know, we got a little while left in this problem, and I think it would be important to kind of maintain that as much as possible.
And Doctor, just following up on that, I think our viewers might benefit from this. I mean, you're not just a healthcare hero, you are, but you're also a family man too. So how do you balance that? I mean, you have to come home every night.
Yeah, it's challenging. I mean, I'll tell you, the first thing I do when I get home is I basically run straight up to the bathroom and shower, clean up as quickly as possible before it's a verbal hello to the kids and to the wife, and then it's not until after I make sure I'm completely cleaned up that we can have a closer conversation. But even with that being said, I have to be careful about, touching my face or coughing or sneezing or anything of those nature, anything of that nature. There is the idea that, you can have minimal or no symptoms and still be a transmitter.
Yeah.
And that is something that I think every single one of us deals with on a daily basis, and certainly gives us concern for our families.
Yeah, it's the new normal. Yeah. All right. Heidi from Massapequa. Heidi, you there?
Yes, I am.
What's your question?
My question is twofold, and I want to thank you very much for taking my call, and I hope everyone remains healthy and safe. And what it is if you have a dental emergency, what exactly can I feel safe going to the dentist if I have a dental emergency, and what should I expect and what should I do? And or secondly, while they're rescheduling the guidelines, I haven't heard them addressing anything that if you do need a procedure done, when maybe might one think of being able to make that appointment set and be able to schedule a procedure that's necessary to be done, even if it's a regular teeth cleaning. But when can we go back to the dentist?
It's a very good question. So I would say that with regards to dental emergencies, there are probably practices that have procedures in place to deal with that. I know in watching news segments across the country, there are dental practices that are dealing with this differently by having their clientele, obviously, one at a time entering the office, cleaning their hands, obviously with hand sanitizer, doing some rinsing of the mouth. The dentist and the dental hygienist and the assistants are obviously in PPE. And I think under those circumstances, you're going to minimize the chances or the risks of transmission between you and the dentist and you, for that matter. With regards to scheduling procedures, I think we're all trying to get on the page with that at this point. I know at Southside Hospital, we're trying to open up clean units at this point so that we can move on to schedule elective procedures, urgent procedures. Emergent procedures are still being done, and again, they're being done with the same cautions. Not only testing the patients, but the healthcare providers in full PPE during those procedures as well.
And Doctor, I know that we haven't gotten to mass production for these antibody testings, but are they doing that for the first responders and specifically in your hospital?
So for serology, they're just starting serology testing at Northwell in general. Of course, Northwell has nearly 70,000 employees, so it's going to take a little bit of time to get through that. But they're starting with frontline personnel, testing them, and determining whether or not they have serology and immunity, suspected immunity to the coronavirus. That is an entire issue in and of itself. Because we're not really sure whether or not this, what the immunity confers. Is this long-term immunity? Is this short-term immunity? We don't simply know at this point. There's no good studies that are available on it.
Okay, that may be a good segue to the next caller. I think that may have something to do with the next question. Al from Stony Brook, are you there?
Yes, I am.
Oh, what's your question tonight?
First thing I want to tell Doc, thank you very much for putting yourself on the line every day, just like the other first responders. I know what it's like. I have three that are on the front line now. One's a chief, an EMT, one's a paramedic, and one is an EMT for Northwell EMS. And I feel for them every day. I'm at the Stony Brook, Long Island Vets Home in Stony Brook. And one thing I like to say, nursing homes and that, and especially VA, has been given a bad name. I came close to death, very, very much, with the virus. I was one of the first ones hit with it. And they got me and kept me alive here. If it wasn't for them, I'd be dead.
Okay, so are you asking if you can get it again?
Yes, that's what I want to know. Now, Some
Okay, and
people
how,
say
and what the symptoms might be. I think we got about a minute left, so let me let the doctor try to answer this.
Yeah, it's a great question, and we simply do not know at this point whether or not you can develop the symptoms of coronavirus or get a second infection of coronavirus at this point in time. Time will tell.
Yeah, it's so that's why they call it novel coronavirus. I mean, we just don't know enough about it right now. All right, we're going to take a real quick break. We're going to come back and have more expert advice on how to keep you and your family safe from the coronavirus. And remember, we want to hear from you. We do want to hear from you. So call us with your questions. That number right there at the bottom of your screen. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Greg Garra, the Associate Chair of Emergency Medicine at Southside Hospital in Bayshore. Before the break, Doctor, we were talking, Al had a question from Stony Brook about possibly getting it twice. Obviously, we don't know yet, right?
That's correct. We do not know yet.
Yeah, and Al, I just want to say at Stony Brook, thank you for your service as a veteran, and certainly stay safe and everything like that. Doc, before we get back to the callers, let me ask you this. I know that there's still clinical trials. Nothing's been validated yet, but drugs like remdesivir and famotidine, are those hopeful drugs right now?
You know, all of these trials have a possibility of showing some impact on the coronavirus infection. We just don't have the answer to it yet. They're currently in progress, and we're hopeful that we'll have data, actionable data, very quickly, very soon.
Okay, have we kind of turned away a little bit from hydroxychloroquine at this point?
The one study that came out last week was a VA study of 368 patients. It did not look good for the hydroxychloroquine and azithromycin arm compared to no therapy at all. So I think that for the most part, we are moving away from those two medications and are looking forward to some additional studies on hydroxychloroquine, as well as studies on all the other medications that you had spoken of.
Okay, all right, let's get back to the calls. Ada, are you there, Ada?
Yes, I am. Thank you for taking my call.
Thank you. What's your question tonight?
I have two questions, if I could please ask the doctor. It's been on my mind. Regarding our air conditioning system, since we'll be going into the summer months, will we be able to run our air conditions?
Yeah, I don't see any reason why you wouldn't be able to run air conditioning systems. In fact, there's speculation that just because of the summer months coming along, that we may have a little bit of a reprieve from the coronavirus, because previous viruses similar to this don't particularly do well in warmer temperatures and don't particularly do well in environments with higher absolute humidity. So time will tell, obviously, whether or not that's going to be the case, but just one more reason in my mind to look forward to the summer.
Yeah. I think Ada also wanted to know if it could pass through the human body. I know it's a respiratory and it's droplets, but I think she wants to know if it can pass actually through the human body.
When you say it can pass through the human body, we're talking about the virus itself?
Was that your question, Ada?
Well, what I wanted to know is, since the doctors all been saying regarding all the states that are trying to open up, that they have to be careful with the venting systems for the air conditioning and everything. That's what I was concerned about. And I do have a second question.
Okay, what's the second question?
This may sound morbid, but it's been on my mind since this happened. Regarding all the people that has passed away from this terrible virus, what has happened to their bodies? Have they been buried, cremated? Otherwise, won't we get a plague? I mean, it's a terrible contagious disease, and no one talks about it.
So whether the virus can live within a dead body for a length of time. Do we know that yet, Doctor?
I don't know that we know the answer to that question. I would imagine that, again, The bodies are being taken care of appropriately. There is, public health measures and laws pertaining to this area, and I see no reason why that would not be the case.
Yeah, and I know that just from our reporting that funeral homes are backed up right now. They're overwhelmed as well, just by, unfortunately, the demand. Let's see if we can't get Ruhami. Are you there?
Yes, hi, I'm here.
What's your question tonight?
Sure, thanks for taking my question. So I live in an apartment where the community is allowed to smoke. So generally, cigarette filters end up being discarded in common property. My question is, can infected filters be conductors of the pathogen by being in close range if they end up in porches or balconies? And in the case of little children who play around, can this put them at risk if they accidentally make direct contact with them?
Stone, it was a little broken up on my end.
I think she's saying, does it smoking? Can it be passed through smoking, blowing it out, flicking butts onto the pavement, and can it be spread to kids and cats when they're playing around? I know we've had a couple of cats that have gotten coronavirus. Sure.
So, the virus is considered to be transmitted through droplet nuclei. So merely the act of speaking does in fact create some droplet nuclei, and that's one way in which it can be spread. There's also the concept of the virus being aerosolized, which means that is contained in even smaller, finer particles that can travel longer distances. Simply flicking butts, I would imagine, isn't going to do it. Blowing out smoke, if you think about it from the perspective of droplet nuclei and aerosolizing spread, there's that potential that's there. Obviously, children are susceptible to getting it. Whether or not animals at this point are susceptible to getting it, I think the jury is out. Certainly, we've heard stories of that on the news. And, we'll know, I think, in due time.
Yeah, unfortunately, that's all the time we have. I want to thank you once again, Dr. Greg Garra, for coming in on the show tonight. You really are one of the heroes, and I thank you for everything that you do on behalf of News 12, on behalf of myself. Thank you very much. And to the viewers, thank you for watching us and for calling in. Stay safe, and we'll see you tomorrow night at 7. I'm Stone Grissom.